Good afternoon, hello friends, and myself Dr. Manish Agrawal, diabetologist and endocrine physician from Ahmedabad. And as first of the, I would like to congratulate with our organizer secretary Dr. Puneet Saxena and giving the platform. And my talk was drugs induced diabetic. Now we are seeing of the lot of the everybody is knowing India is a capital of the diabetes. After the China, India stood second number of the, at present we are having the 79.2 millions are diabetic patient across the India. In fact, when we can say out of the 1 Indians are a diabetic, either pre-diabetic, these are some of the and most of the one of the reasons of the diabetes is a, we can say, drugs induced diabetes. There is a lot of the drugs over the counter we are going to use of that can induce the diabetic who are having the pre-diabetic populated or taking the such type of the medications, they can convert into the diabetic, and thus definition can say drugs induced diabetes. These drugs can decrease the insulin secretion from beta cells. Either it can cause the insulin resistance, it can cause the both way, either the decrease the insulin secretion from the beta cells, either the insulin resistance. Just I am going to giving the some example of this particular, the beta blocker is a propanol, ethanol, metoprolol are widely used in our particular heart failure, angina, antihypertensive, but that can decrease the insulin secretion from our beta cells of pancreas and can cause the develop the diabetic after the couple of the months. So I am going to requesting all the clinicians who are practicing as a diabetologist, patient on the beta blocker, just ethanol, metoprolol, propanol, we should check the fasting blood sugar and post-prandial blood sugar, HbA1c after the 3 months of this particular. Second, I am talking this particular most common drugs is statin, or according to the American diabetic, all the national international guidelines, all the diabetic patients should get the statin, lipid lowering agent. One of this statin can cause the develop the diabetes, newer diabetes is a tune of the 9 to 33% of this particular. FDA in 2012 has warned to that this particular statin can cause the diabetes except the pravastatin. Pravastatin can reduce the diabetes, otherwise all the statins, I am talking with this particular rosuvastatin, atorvastatin, simvastatin and other statin, they can increase the diabetic and statin induced diabetes of the. So all the patient, diabetic, a pre-diabetic, a non-diabetic patient, they are on statin, we should get the fasting blood sugar, post-prandial blood sugar and HbA1c frequently every 3 months of this particular. And third drugs I am talking this particular, we are seeing last couple of the years in the COVID-19, and already COVID-19 everybody is knowing that was the worst time from 2019 to 2021. We deal with the 2 years of the COVID, and what was treatment was COVID was steroid, and steroid are huge, widely used in particular day-to-day clinical practice. Steroid can cause the diabetes by the mechanism, the increase the hepatic gluconeogenesis as well as increase the insulin resistance, and it can use an immunocompromised patient as immunosuppressive patient and rheumatoid and autoimmune disease and some of the anti-COVID, COVID, whatever the atypical infections. So all the patient steroid is a frequently can cause the diabetes 2 to 2.5 times more compared to the non-steroid user. And fourth drugs is a thiazide. Thiazide diuretic, I am talking this particular, the Lasix, furosemide, indapamide and thiazide like diuretic. Most diabetic patients, pre-diabetic patients, thiazide are used in heart failure, antihypertensive medicines, antihypertension medications, and most of the patient is taking over the counter without the permissions, without the prescription by the clinicians. So again I am talk with this particular, give to message to all the clinician patient on the thiazide, diuretic, thiazide like this group, they should check the frequent monitoring of the fasting blood sugar, post-prandial blood sugar, HbA1c patient are on this particular thiazide group. And fifth drugs, most common cause is antiretrovirus. Most HIV is going to increasing, and patient is having this particular the lot of the anti-HIV drugs therapy, and that can cause this particular the diabetic. So these are 5 to 6 drugs are more common used day to day, even the over the counter they can develop the drugs induced diabetes. My talk was on drugs induced diabetes and how was deal with of drugs can cause diabetic and how to prevent on how to monitoring and how to treat the drugs induced diabetes. Once again, thank you.